Hey everyone, Dr. Ed here, and I was hoping to talk to kids today about something called mental health. This might be something that you've heard about in the past, maybe on announcements, or maybe a teacher or a parent have talked to you about it. Well, the reason I want to talk about it is because this week is Mental Health Awareness Week, which sounds pretty important. But what is mental health? Well, I think it's easier to start with the idea of what does healthy mean. When I ask somebody what does healthy mean, many times they'll tell me about things related to their body. So they might talk about how they're doing exercising and being active, like when we go to gym class and run around the track or do jumping jacks. All those things are helping us to be healthy. But what does it mean to be mentally healthy? Well, having mental health means that we are able to deal with all the difficult things that might happen, like the big emotions that make us uncomfortable, like anger or sadness, but also being able to understand when we're having a difficult moment and knowing what we can do to sort of help us out of those difficult moments, like turning for help. So, being mentally healthy means being able to deal with the big emotions, the difficult things that come our way, but also being able to continue to do the things that we love, to feel connected with others, and to do things that continue to allow us to grow. So let's talk a little bit about what things are important to be mentally healthy. Well, the first thing is being able to have a connection with others, feeling as if we belong. And so that may be hard for some of us during COVID 19 because we're not in school and we may not be seeing our friends. So, one of the things that I would want to talk to you about is how can we continue to feel connected during COVID 19? Part of it might mean reaching out to your teachers and making sure you're connected with them, maybe through the internet or through videos like this. And for some of us, if we don't have internet, it might mean a phone call and just making sure that we're connected. It might also mean being connected with some of our classmates, again, maybe over the telephone or over the internet. If we can't do any of those things, maybe we can feel more connected by doing things together as a family. So maybe it's eating as a family, it's doing activities as a family, which can also be difficult, right? So if your parents are very busy or they're stressed out with their work and maybe they don't have that time, maybe you're spending some time with a brother or a sister, or maybe sometimes, you can just find yourself doing something right next to your parents. Even if they're doing something else, sometimes just being next to a loved one can make us feel a little bit better. Another area that's really important for mental health is the idea of feeling safe. We really can't do and focus on anything if we're not feeling safe, which I think is something that we may be sort of having trouble with right now during COVID 19. So I just wanted to point out to the kids out there that if you think about all the things that your loved ones are doing, like your parents or even the caring adults in your life, like your teachers, we're doing certain things to keep you safe. So the fact that we're not going to school, that the reason we're doing that is so that we're all safe. And we're also doing other things like washing our hands, wearing masks if we go out, or making sure that we have some distance between ourselves and others. Those are all things that we're doing to keep safe. So I just want you to remember that your loved ones, your parents, your teachers, your caring adults, we're doing things to try and keep you safe during COVID 19. And the last part that's really important is to continue to remember to do the things that are important to us and that we need to do every day, like getting good sleep, eating well, continuing to do the things that we love, like learning, reading, drawing, art, music, dancing. And some things that may be a little bit more hard to do now are things like playing sports. But maybe we're watching videos on YouTube that will help us to continue to do things that are active or that are related to some of the sports that we're doing. So those are really important, to continue to do what you love to do. Okay? And if we're doing those things like connected with others, we're feeling safe, and we understand that the caring adults are doing everything they can to keep us safe, and we're continuing to do things that are important to us, like eating well, sleeping well, and continuing to learn and to do the things that we love to do, then I think we're working towards having mental health. Okay, so I hope that made sense. And if you have any questions, you could always reach out to the caring adults, and they can help to explain things a little bit further. Okay, thank you very much, guys. I hope you're doing well. Take care.